Hi, my name is Eleanor Tatum, and I'm the publisher and editor-in-chief of the New York Amsterdam News. The coronavirus crisis has brought serious distress to local economies and advertising along with them. The New York Amsterdam News has partnered with the Local Media Association during this unprecedented crisis. Help us continue our important work in chronicling the life of Black New Yorkers, and consider making a donation to the COVID-19 Local News Fund today. Go to givebutter.com/Amsterdam News. Again, that is givebutter.com/Amsterdam News. Thank you and stay safe.
It's Monday, April 11th, and welcome to the New York Amsterdam News Podcast. I'm Cyril Josh Barker. We continue our coverage of the COVID-19 outbreak with the second installment of our Monday's Mayor series with my guest, Mount Vernon, New York Mayor Shawyn Patterson-Howard. She's going to be speaking with me about how COVID-19 is impacting her city. According to the Westchester Department of Health, the city of Mount Vernon has nearly 2,500 confirmed cases of COVID-19. On March 16th, Mayor Shawyn Patterson-Howard declared a state of emergency in the municipality, which is 20 miles away from New York City. Mount Vernon opened its first COVID-19 testing site on April 17th. State Attorney General Letitia James recently went to the city, joined by other state legislators, to give away 2,000 masks and hand sanitizers to local residents. And we welcome you to this episode of our podcast. And we're so happy to have Mayor Patterson-Howard, who's going to be speaking with us today about how she's handling things in Mount Vernon. A lot of the things that she's saying definitely could resonate and can be used as examples in other cities. So I'm very happy to have her on. She's actually the second mayor in our series, in our 4-part series that we're doing, Monday's Mayor. We have 2 other mayors coming up. We're just working out some scheduling time, and we're going to have them come, and as soon as we have them, we'll let you know. Well, there's lots of news going on. I want to highlight first, we had several deaths that happened over the weekend, including rock and roll legend Little Richard, who died at age 87, record producer Andre Harrell, who passed away at age 59, and soul singer Betty Wright, who passed away at age 66. These 3 people gave so much of themselves and contributions to music, and our prayers definitely go out to their families. Another passing I want to highlight is the death of Eastside High School principal Dr. Gerald Glisson in New Jersey. A lot of you all responded and shared this story on our website, and we're so happy that you did. He died at age 46 from complications from COVID-19. He was a beloved man in his community, and so many people looked up to him, and we definitely want to reach out and give prayers to him, to his family. We actually have a tribute video on our website that his fraternity brothers did from Omega Psi Phi. They put it together, and we have it on our website. And again, our prayers definitely go out to his family. We plan on having coverage on all 3 of these passings in the paper and online on Thursday. Another thing I want to discuss is we're going to be doing more coverage this week and possibly doing an upcoming episode on the shooting of Ahmaud Arbery in Georgia. If you know that story, it's the story of the African-American man who was jogging in a South Georgia neighborhood who was shot by 2 white men. And they eventually got arrested 2 months after the shooting. So again, we're going to be having an upcoming episode about that and doing more coverage in the paper and online this week. Well, my guest is Mount Vernon Mayor Shawyn Patterson-Howard, who's on the phone to discuss how COVID-19 is impacting her city. Welcome to the podcast, Mayor. How are you?
I'm well, and yourself?
I'm doing good. Thank you so much. Well, I just kind of want to get down to the basics of what's going on with COVID-19 in Mount Vernon. What's the situation like down there? Or up there, rather.
Well, Mount Vernon is 4.4 square miles. We have about 100,000 residents here, so about 25,000 residents per square mile, making us one of the most densely populated communities in the country. And so we know that density definitely adds to the infection rate of COVID. And so lots of people living in apartment buildings. We have some, definite impoverished communities and lots of people here who are living with underlying medical conditions. We're an underserved medical community. So we have some challenges going into COVID, and COVID has only really exacerbated them and brought them out to the forefront.
Mm-hmm. And tell us about the steps that you're taking to slow down the spread in Mount Vernon.
So steps that we've taken, we really were paying attention to what was kind of happening in China, but definitely once it started moving around in Washington State. And back in February, we created our Emergency Operations Center. I'm a new mayor, so I'd only been in office, for less than 2 months
Right.
when this was starting. And we understood that in putting together our Emergency Operations Center, and this being a very infectious and contagious virus, that we could not put people in one building. So we couldn't put them in a regular building and have everyone work together. Mm-hmm. So we've had about 45 people on our emergency operations team from across every department of the city. And we've done Monday, Wednesday, Friday Zoom calls, and then on Tuesday and Thursday subcommittees. So we've put together things like the social distancing task force, which was combined of police and fire, Office of Emergency Management, as well as those departments primarily, making sure that they were going out and dealing with the supermarkets, the banks, and different businesses mm-hmm. to ensure that people were practicing social distancing guidelines. Because, we knew that was going to help us flatten the curve. Secondly, we also have our Essential Businesses Task Force, and that was to make sure that the businesses that were not supposed to be opening were not opening. The hairdressers, the nail salons, mm-hmm. and, of course, people have been losing income, and people want those services, and so, those businesses would always try and sneak and open, and while we understood that everyone has the right to make money, we also understood that the public health of our community in this incident had to come first. Mm-hmm. And so we have different people, including our buildings department, police, fire, Office of Emergency Management, the mayor's office, working to interact and deal with those businesses. So social distancing, we were pushing and we were enforcing, keeping essential businesses closed so that would not further the spread of the virus. We were working on that, working closely with the county of Westchester and the State Department of Health, because we needed a testing center. The only testing center in Westchester County was in New Rochelle. And it took us about 5 weeks into this crisis before we got a testing center. Mm-hmm. And we know testing was one of the biggest challenges that people had.
Right.
If you wanted to be tested, you had to almost be dead. Yeah. You had to have a fever, you had to have a multitude of symptoms, and it might take them several weeks for them to get back to you to give you an appointment. And by the time you finally got an appointment, you could have gone through the virus and been recovered, or you could have become much sicker, hospitalized, mm-hmm. and died, or whatever the situation was. So we worked closely with our senators, Alessandra Biaggi and Jamal Bailey, our Senate leader, Senator Andrea Stewart-Cousins, as well as our Assemblyman Gary Pretlow and our County Legislator Lyndon Williams, and we were able to finally push and get that walk-in testing site here in Mount Vernon. We continue to work on educational campaigns. Mm-hmm. We created, within our EOC, we had our communications team, and they put together a special portal on our city's website so that people could go in and get information and hit links of local city, county, and federal resources. We started I've always done a show since I was campaigning called Sundays with Shawyn. Okay. But then we also started doing Tuesday and Thursday internet updates. Tuesday and Thursday internet updates, so people could get, I'm not Mayor de Blasio, I'm not the governor, we don't get television time. Yeah. So how could we communicate with our residents? So we created a schedule on Sundays, Tuesdays, and Thursdays where for an hour we updated them on the numbers, the resources that were available, the new hotlines, the payroll protection grants, the disaster loans, mental health services. So those are some of the things that we did. But within our Emergency Operations Center, we had our operations committee. We had a logistics committee, which was a lot of human services. People are hungry.
Yes, absolutely. Absolutely.
Yeah. We're giving away hundreds of thousands of pounds of fresh produce as well as non-perishable items each month here in Mount Vernon. We've been delivering to senior buildings. We expanded our sick and shut-in meal delivery. We did different food pickups around the community because hunger became a big issue, especially as the governor's emergency order went into place and people were being furloughed, were being laid off, were losing their jobs, and the economic reality of this began to hit the communities. So we've always had about 1 out of 4 of our residents in Mount Vernon that we knew were food insecure.
Right.
But this crisis has almost brought it up to about a 45 to 50% rate. And the face of hunger expanded from poor black and brown people to working class black and brown people to middle class black and brown and white people. And we really had to push the narrative that this was a way, this didn't mean that you were poor and homeless, and put your pride aside and make sure that these great food resources that were coming into the community, that you tapped into them. Mental health services, and I know I'm kind of, but there's a lot of stuff that we were doing.
Yeah, no, this is great,
We engaged our mental health agencies here, and so on Tuesdays and Thursdays for the mayoral updates, and of course everything started happening on Zoom, we would do Zoom meetings, and we would bring in mental health professionals, we'd bring in the superintendent, we'd bring in public health experts, the commissioner of health, the county executive. We just brought in industry experts from the restaurants and from the nail salons and the hair salons, and we just did interviews with them on Zoom that we aired live on Facebook.
Okay.
And so we could get questions from the community. We just tried to keep the education very interactive so that the community could hear our voice, but we could also hear the community in real time and answer questions. We created flyers, educational flyers with QR codes on them, and put them up all around the city.
Okay.
So that people could just take their... Look, I have an incredible and a dynamic, I have some incredibly dynamic young professionals on our staff.
Yes.
And so we wanted to make sure that we were utilizing all platforms of media and of communication to push this information out of it. And so QR codes were sexy for some people, and so we used them. And we created our own QR code. We put them on flyers, and we put them in all of the businesses, the supermarkets, the apartment buildings, the bus stops, and we just told people, look, take your phone and hit this QR code, and it's going to take you directly to the website. You'll be able to get all of the information that you need, and you'll be able to kind of move forward, and that was helpful. We tracked the infections. We saw that they were not just clustered in one neighborhood or another, but they were throughout the city. We did education campaigns in apartment buildings as we saw hot spots and hot zones, being created in apartment buildings. So we did a lot around education. We did, and education for us was more important than enforcement.
Absolutely.
Because, we over-police our own community sometimes.
Yeah, we're seeing that here in New York. Yeah, we're seeing that here in the city.
Right, and so there would be people in the community. It was very interesting. What was interesting is the community wanted us to police the community more heavily. We're like, there's guys in front of the bodega playing, shooting dice. What are y'all going to do about that? It's 10 of them, and they're not social distancing. So we went out there and educated them, and the next day people were out there shooting dice in blue gloves. And then we got them to come up.
It's so funny. They need to do that here because we did a huge story on the front page of the paper last week just about how social distancing is being enforced. So again, that's, one of the reasons why we're doing this series, to let people know that there are black folks and black leaders who are out there doing things how, showing us how things should be done. So that's so interesting. Yeah, that's great. One of the things I wanted to...
And we eventually moved them off the corner and off the block and playing dice. So, but we know that our community, they don't have backyards, and they don't have 2 or 3 bedroom apartments. You could have a lot of people living in a 1 or 2 bedroom apartment, so they're not social distancing in their apartment, let alone we're telling them they can't come outside. And so that becomes a challenge and you see the anxiety and the depression and the mental health issues and the domestic violence issues increase. So we had to find a creative balance between allowing people to move a little bit within the community and just totally locking them in their houses and the other conditions that would bring about. This is fluid, and we've remained fluid and flexible in how we work with our community.
And I'm loving everything that you're saying, because a lot of the issues that you're mentioning are happening here in the city and other places, larger municipalities, and you seem to just are doing it the right way. So I certainly hope that anybody who listens to this takes example from what you're doing. And the other thing I want to mention to you is the food thing. I think that's wonderful that you're doing with the food situation. I was just on a conference call today with the mayor's office just about how the food situation is and the hundreds of thousands of people here who are getting the food and need it. And there's all types of programs out there. So I appreciate that you're doing that, because that's so important. How now, one of the things I say about COVID-19 is that it really exposed a lot of the disparities in our communities. And so the fact that you're doing that is phenomenal. What I want you to talk about is education. How is that being done? Are you guys doing remote learning? What's been the decision on how schooling is being done in Mount Vernon?
Absolutely. We shut our schools. Our superintendent was probably one of the first superintendents in the state to shut down the school. We had a parent, some of the first cases of COVID were in New Rochelle that we knew of, and that's a neighboring community. And one of the parents worked at the hospital where patient 0 was, and as soon as that information got out in the schools and that parent was quarantined with their children, it was a very, very quick response from the community, like, oh God, we can't let this penetrate our community. Mount Vernon is, like I said, 4 square miles. So we're small town, but when you have 25,000 people per square mile, you're big city.
Exactly,
so
right.
we're a small town community with big city issues and population. And so we had to make some quick, decisive actions, and he didn't wait for other people's guidance. He closed down the schools quickly. We worked with the school district to develop a grab-and-go food program. We came together, and the school district had already been kind of working on some remote education programs to probably help with after school and with summer school. So they had already started to, they already had a framework for remote learning, and they were able to institute that and get that up off of the ground in about a week. I brought the superintendent on my Sundays with Shawyn Facebook Live show, and we made a plea to the community and asked for donations of, laptops, iPads, Chromebooks, whatever it is that our students needed, and we were able to start giving out several hundred laptops to the young people in the community.
That's amazing.
We're still doing that effort. Our educational foundation and our alumni group from our school district, we're going out to them and asking them for help. I am a Delta. I'm a proud member of Delta Sigma Theta Sorority Incorporated. My chief of staff is Alpha Phi Alpha, from Omega to AKA to Sigma to Zeta, Sigma Gamma Rho. We're all here as part of city government, and so the Deltas are giving 60 devices to the school district. I spoke to the president of the Qs last night. They're going to match it. They took that vote last night,
amazing.
And now we're going out to the whole Pan-Hellenic, the Divine Nine, to ask them to each do the same, because it's our responsibility. Our children are already academically challenged. Our children are already behind. And the summer's coming, and we worry about the summer slide. That's only 8 weeks. But our kids have been out of school. They're going to be out of school from March till September. And in September, we don't know what education is going to look like.
Absolutely.
We don't know if these children are going to go to school 5 days a week, or are they going to go 3 on 1 week, 2 on another week. What is that going to look like? Are we going to have to provide all day, alternatives, community-based alternatives through our youth department and through our recreation department. What are we going to do? So we are having those crucial conversations now because we don't have the luxury of waiting on guidance from a task force that's now just being created around education, because not educating our children properly, we're going to feel the immediate effects here. So we have to be proactive as opposed to reactive, and we know that whatever is created by the state or the county, we're going to have to enhance it and add to it because our children are black and brown, and they already started from a place of deficit.
One of the things I noticed that on Sunday, yesterday, you had Letitia James was in Mount Vernon yesterday. You guys did 2,000 masks and handed out hand sanitizer. Tell me about that experience and what is that looking like? Are you guys giving out periodically PPE products and things to residents, and what's going on there?
Definitely. So we received about 18,000 masks from the state, and we've been giving them out at our food distributions. We've been giving them out as we deliver meals. We're sharing them with our not-for-profit agencies and some of our businesses, but we also did a general community one where we just wanted to bring together people on the plaza of City Hall and give out the hand sanitizers, give out the face masks, remind people of the importance of completing the census. So we got a DJ and everything.
Wow!
But unfortunately,
you were able to incorporate all that. So you got the awareness for COVID-19, and then you're also handing out PPE, and at the same time you're making people aware hand sanitizer and making people aware of the census. Now that right there that's great. And people, and was there a lot of people? What was the response?
Yeah, I mean, it rained. This was Friday, so it rained. It ended up, no, it was Thursday afternoon. It ended up raining, unfortunately, all day. No, it was Friday. It rained Friday
it was Friday,
afternoon.
okay.
It rained steady all day, but we were able to still give out about 2,000 masks and hand sanitizers. We just got off our emergency operations call, or I got off to get on the phone with you, and we have a plan to go to about 10, 15 senior buildings. We're going to work with the tenant associations to make sure all of our seniors get it. We are contacting the neighborhood associations to make sure that the neighborhood associations have a few hundred so that they can walk around within their neighborhood and take care of their community. Government can only do so much, so we have to use a cross-sector approach, and that really means engaging our citizenry. This is not going to be a temporary thing. We're going to have to continue to do things like this potentially for the next 2 years as we try to manage and maintain the flattening of this curve. So we want to build the capacity of our residents. We want to build the capacity of our stakeholders and our community partners in each of the sectors to help them understand that they're just as responsible. And we want to empower them because the health of our community is going to be all of our jobs. The government can't do it alone.
Right.
And so we're starting that now, is really pulling them in to be partners with us to make sure that we get to, that we're able to penetrate the community at the level that we want to penetrate it and get it to the people who need it most. And so that's what we're doing. We're excited about those partnerships. We're excited that our Attorney General, Letitia James, came down and handed masks out with us, as well as our Senator Jamal Bailey and our Congressman Elliot Engel. We're going to do more giveaways with our other state senators and assembly people, our county legislators, and we have, I believe on Wednesday, we'll be working with quite a few of our clergy, our United Black Clergy, to give out more masks and sanitizers and stand up some more walk-in testing. But the other thing that is critically important, especially in our black and brown communities, that we do is, while we're expanding testing opportunities, we also have to make the antibody testing available.
Yeah.
And I say that's so important because there were so many people who I believe were infected or exposed, but because they never had the opportunity to get the COVID-19 tests, they went through it without being clearly identified. So if we can do the antibody testing, then we can really get a better understanding of how much this penetrated our community. And then we will know how to plan going forward. They're talking about a second wave.
Yes.
We know as we reopen the community, we're going to have to constantly look at the data and the metrics. We went back and looked at the data from EMS runs, from ambulance runs back in December, and we were seeing some of the same symptoms as we went back to December and started, before we knew about COVID, and we were seeing people dying back then and people being hospitalized back then. So data is so critically important to how we're going to manage, how we're going to learn about what happened now so that we can manage this going forward. And it is, like I said, it's not government alone that can do this. And, economically, Black and brown communities are always the hardest hit, and we're always the last to recover. And we're almost always blamed for the failure and what happens to our community. Yeah. So we just have to take some bold actions, and we will be, resuming. We were doing a business class through our community development block grant and teaching people how to open up their businesses and be entrepreneurs and gain access to capital. That was derailed by COVID, but now we just need to go back to doing that and offering those classes online through Zooms or through some type of online distance platform system. We have to find creative ways to do business in not a post-COVID environment. And that's, if I can't say anything more, we are not moving into a post-COVID environment. COVID, we have to understand, is going to be with us for the next few years. We are going to do business in a COVID environment. And so we have to look at the financial realities and practicalities, but we're going to have to keep public health at the forefront, and we're going to have to deal with the social determinants of health and education, and ensure that we are addressing the historic inequities that have presented themselves, and really start finding, not just finding, but demanding solutions. And we can't be apologetic about it. We can't ask for permission, but we have to press into it. And we're going to have to come together as leaders of color and communities of color, and find collaborative solutions across the state to make sure that our communities are taken care of and protected, because no one else is going to do it for us.
All right. Well, listen, Mayor Patterson-Howard, I think you're doing amazing work out in Mount Vernon. Please keep it up. And, you should definitely come down to the city and teach them a few things, because we need some help down here. But
well, I've been a social worker and a public health official for over 30 years.
Okay.
And so I think I'm coming into government with a lot of community health and human services understanding. And that's where we have to lead right now, in that environment, as well as economic revitalization.
All right. Well, listen, thank you again so much for being on the podcast today. And we were so happy to have you. Thank you again.
Thank you. Be well.
That concludes this week's podcast. You can pick up the latest edition of the New York Amsterdam News on newsstands and get updates online at amsterdamnews.com. You can also keep up with us on Facebook at NY Amsterdam News and follow us on Twitter at NYAmNews. I'm Cyril Josh Barker. Thanks for listening.
Hi, my name is Eleanor Tatum, and I'm the publisher and editor-in-chief of the New York Amsterdam News. The coronavirus crisis has brought serious distress to local economies and advertising along with them. The New York Amsterdam News has partnered with the Local Media Association during this unprecedented crisis. Help us continue our important work in chronicling the life of Black New Yorkers, and consider making a donation to the COVID-19 Local News Fund today. Go to givebutter.com/Amsterdam News. Again, that is givebutter.com/Amsterdam News. Thank you, and stay safe.